Hello and welcome to Medical Dialogues. I am Dr. Bhumika. Let's look at today's top medical news. Lowering risk of Alzheimer's in diabetes patients, Simaglutide may help. Researchers at the Case Western Reserve School of Medicine have found that when compared to 7 other anti-diabetic drugs, Simaglutide, a popular diabetes and weight loss drug, may lower the risk of Alzheimer's disease in people with type 2 diabetes. The study, published in the Journal of Alzheimer's and Dementia, the Journal of Alzheimer's Association, suggests type 2 diabetes patients taking Simaglutide has a significantly lower risk of developing Alzheimer's disease. Unveiling the role of feeding practices in infants' rapid weight gain. A UNC Greensboro study following 299 women and their infants from pregnancy to toddlerhood examined multiple psychological, biological, and social factors in the context of infants' rapid weight gain. They found infant feeding practices associated with obesity, known as obsogenic practices, are strongly correlated with rapid infant weight gain. Examples of obsogenic practices described in their recent pediatric obesity paper include watching television while feeding a baby, formula feeding, and supplementing a bottle with additional foods. The key take-home point is that what and how parents feed their infants in the first 6 months of life has tremendous implication for obesity risk. And childbearing parents who experience more stress during the prenatal period are particularly likely to engage in these unhealthy practices, says Dr. Esther, a UNCG professor in human development and family studies who served as a lead author on the paper. Infants who gain weight rapidly before the age of 2 are at a higher risk for obesity. Genome sequencing for expanded newborn screening and early intervention. Early results from a study of newborn screening methods show that DNA analysis picks up many more preventable or treatable serious health conditions than standard newborn screening and is favored by most parents who are offered the option. The findings were published in JAMA Network. The study, called Guardian, is one of the first large-scale studies in the world to use genome sequencing as a method for newborn screening and is the first to publish preliminary results. The results show us that genome sequencing can radically improve children's medical care, says Joshua Milner, Professor of Pediatrics, Director of Allergy, Immunology and Rheumatology at Columbia University Vagelos College of Physicians and Surgeons, and one of the study's co-authors. Genome sequencing allows us to detect things that cause serious illness and take action to prevent those illnesses in a significant number of children, not just a few rare cases, says Milner, who is also the Chief of Allergy, Immunology and Rheumatology Services at New York Presbyterian Morgan Stanley Children's Hospital. It should be instituted as the next standard for newborn screening because it can detect so much more than current methods. Improving eye health, eat pistachios. Researchers. A new study from researchers at the Friedman School of Nutrition Science and Policy at the Tufts University has found that consuming pistachios daily may significantly improve eye health by increasing macular pigment optical density due to the plant pigment lutein, a key factor in protecting the eyes from blue light and age-related damage. The randomized controlled trial showed that compared to eating a usual diet alone, eating 2 ounces of pistachios per day for 12 weeks as part of a usual diet resulted in a significant increase in macular pigment optical density in otherwise healthy middle-aged to older adults. Macular pigment optical density is an important indicator of eye health as it protects the retina and is linked to a reduced risk of age-related macular degeneration, a leading cause of blindness in older adults. Findings from this research are timely as, according to a national poll by the American Foundation for the Blind, Americans fear vision loss more than they fear other serious health problems. Thank you for watching Medical Dialogues. Stay tuned for more such updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.